So a very good evening guys, welcome back to this particular session. So in this particular session we'll be talking about the biomedical waste management guidelines. The importance of this topic can be known by seeing the previous year papers. Either you can see FMGE, either you can see the NEET PG paper, or either you can see the INICT paper, right? In each and every exam, okay, which is related to the medical, this question will be asked. Why is it so? Because in the hospital, every hospital, okay, you might be working in some hospital, either in the private hospital, either in the government hospital, these BMW guidelines are actually followed everywhere, right? And there are strict punishment if they are not being followed by any kind of hospital, right? Be it private hospital or be it the government hospital, right? So it is very important for us to know, because who is working in the hospital at last? We, the healthcare professionals, are working in the hospitals, right? So it should be known by the nurses, and it should be known by other healthcare staff, right? So let's begin with the biomedical waste management, right? So it's a very important topic, and definitely one or two questions will be expected over here from this particular topic. So listen to this topic very attentively. So biomedical waste management, here if we talk about what is this, first of all, what is BMW or biomedical waste management, right? So if we talk about BMW, right, this is particularly any kind of waste which is actually generated during diagnosis, right? During diagnosis or during making any kind of treatment, during diagnosis or during treatment or during immunization, right? Immunization of either human being or animal, or during any research activity, okay? So what do I mean by this definition? Basically, I mean to say that, basically these kind of waste, this BMW waste which we are not generating in our homes, right? Usually we are just, in homes, what kind of waste do we have? It can be food waste, it can be some, packets and packets waste, paper waste. These kind of waste are not coming in the biomedical waste management guidelines, right? This is actually coming in the municipal waste. So biomedical waste management, basically it is actually producing at practical level. If I will be talking about, it is actually producing in the laboratories, it is producing in the clinics, it is producing in the hospitals on the bigger level, right? So these are the places where biomedical wastes are actually generated. So basically, what kind of waste we shall talk about? It can be, during any kind of diagnosis. For example, you are taking the blood sample, right? Blood should be discarded in some particular, category. According to the BMW, I will talk about that you are taking that in the basically that vacuolators, right? So they should be discarded in somewhere else. You are using the syringes, they should be discarded somewhere else, right? There are the medications which you are giving to the patient, there are the ampules, there are so many things which you are using in the hospital settings, right? They should be discarded at their appropriate places, right? And the purpose of this class is to understand and to know that what are the places, what kind of categories we'll be using as far as the disposal of these kind of things are there, right? So all of these things will be considered under the biomedical waste, right? So basically, biomedical waste, if we talk about some part of history over here, it was actually introduced 1998, right? So it was actually introduced in the 1998, right? What was introduced? This was the biomedical waste management guidelines, right? Right? What was introduced? Biomedical waste management, biomedical, bio, B for bio, M for medical, and W for waste. So biomedical waste management guidelines, right? Management guidelines. So over here they were introduced in 1998. Now after that, what happened in 2020 to 2021, right? Even before that, in the year 2016, right, there was Amendment Act, right? So what happened in year 2016? There was BMW Management Guidelines Amendment Act. So it came in 2016. Amendment Act, okay, Amendment Act, and it came in 2016, very important. After that, we shall remember that, in 2020, what happened in 2020? Very popularly, COVID-19 came, right? COVID-19 came into the picture in 2020, and obviously we should be having some plan, right? At that point of time, if we think, right, we can't actually dispose of COVID-19 things over there, here and there, right? So we came up with different kind of guidelines for the COVID-19. We'll be talking about them. So it came in 2020 to 2021, that period of time, right? So 2020 to 2021, that period of time, it came the COVID-19 disposable guidelines came over there, right? So COVID management guidelines, we shall write over here, COVID management guidelines. Okay, fine. So we'll be talking about them separately, but first we should be understanding the biomedical waste management guidelines, and then automatically we'll be understanding the COVID management guidelines as well. It will be comparatively easy, right? So basically, there is one more term I would like to introduce over here, that is, if you talk about what actually happens, for example, you are in a hospital, right? Obviously, what will happen? The waste will be generated in the hospital. So what will be happening? First of all, it's your responsibility that you should be actually understanding that what kind of waste should be going in what kind of bin, right? So we are having 4 kind of bags over here. We'll talk about that shortly. Okay, so appropriately we should be actually seeing that things are happening in an appropriate manner. So for an example, if this is the syringe should be going to its appropriate place, right? Its appropriate bag, basically. Okay, we'll be talking about in what dustbin, in what kind of bags we are disposing what things, right? We'll talk about that shortly. So that is the thing. So it should be actually going to the common area, right? Then it will be going to the common area, and it will be picked up from the common area by one kind of authority, and that authority is the authority over here, which I'm going to talk about, that is the CBWTF. What is the CBWTF? CBWTF is Common Biomedical Waste Treatment Facility. Waste Treatment Facility. Okay, so basically this is the CBWTF. So what will happen, guys? For an example, here, right? Here some kind of waste generated, right? It is the BMW waste, biomedical. It is the biomedical waste. It is segregated over here, right? Now what will happen? You are in a hospital setting, right? You are in a hospital. It will be actually transported to the common area. It will be actually transported to the common area. I mean, some worker will be actually placed it in the common area in the hospital, right? So it will be actually going to the common area. Let's say this is the common area. Okay, it will be going to the common area. Now what will happen? Some worker, okay, that worker will be coming from here. And he will pick this waste. Okay, BMW waste from the common area, right? And they will transport it back to the common biomedical waste treatment facility. And now at this point of place, right, at this point of time, now they will be treating it, or they will be disposing it, this particular biomedical waste, right? Hospital responsibility is that they will be segregating the biomedical waste and they will be keeping it in some particular common area, right? One kind of worker will be coming from the common biomedical waste treatment facility. They will pick this particular kind of biomedical waste and they will take it back, and there they will be treating this particular waste, right? That is the idea basically. So what body is working for this particular work? This is the common biomedical waste treatment facility, and they are government authorized, right? Okay, once we have understood this, one thing I would like to mention over here, please note that whatever waste which we are keeping in the common area, right, we are not pre-treating it. It's not our responsibility to pre-treat it. Common biomedical waste treatment facility will do whatever they want to do it. They will be treating this particular waste, but we are not treating it. So basically what we want to say is that pre-treatment of the waste, pre-treatment of BMW waste, pre-treatment of biomedical waste is not required except few conditions. We'll talk about those conditions, right? Except few conditions, right? And what are those conditions? We'll be talking about them shortly. Okay, so once we are clear with that, now I shall be talking about one more thing over here, that if we talk about this particular biomedical waste guidelines, okay, we are saying that biomedical waste guidelines 2016, because in 2016 this amendment act was updated over here, right? So it is actually controlled under the CPCB, right? So actually BMW, right, BMW guidelines 2060, right, it is actually it is actually made by CPCB, right, Central Pollution Control Board, and this is the sign for the CPCB which might be asked over here. So here you can see that in pursuit of the clean environment, right, Swachh Paryavaran ke liye Pratibadh. So this is the CPCB basically, right? It is actually controlling the BMW BMW waste management, right? BMW guidelines, right? One more thing over here, that it is coming under which ministry? It is coming under Ministry of Forest, Government and Climate Change, right? So it is coming under which ministry? It is coming under Ministry of Forest, Environment and Climate Change. Forest, Environment and Climate Change, right? So they are actually governing this particular BMW guidelines. Okay, once we are clear with that, now we shall move on to some waste which are not coming in the category of biomedical waste, right? That can be very commonly asked. So basically every waste is not coming under the biomedical waste. We have already talked about the definition also, that the waste which we are generating, in the hospital settings or in the clinics or in the laboratories, those kind of waste are actually, we are concerning that these are the BMW waste. But still, what kind of other waste which we are having, which we are not considering under the biomedical waste? So let's talk about them as well. For example, if we talk about the solid waste, basically it is not coming under this particular category. Solid waste is coming under the municipal waste category, for example, fruit peel off, plastic bottles and all of those things, right? It is coming under a separate category. Solid waste we are not considering under this one. For that we are having different management rules. E-waste, that is electronic waste. Again, for the electronic waste we are having a separate body which are actually governing the electronic waste. If you talk about the radioactive waste, again radioactive waste is not a part of the BMW guidelines. Okay, so please be very careful with that. So it is actually coming under the Atomic Energy Act, right? It is not part of the BMW guidelines. Hazardous chemicals, again they are not part of the BMW guidelines. Biomedical waste management guidelines, they are not the part of, we are talking about 2016 guidelines. Okay, so for that there is a separate body which are actually working for that. Construction and the demolition waste, it is also not coming under the BMW guidelines. Then the lead acid batteries, lead and all these kind of things are not coming under our BMW waste management guidelines, right? Hazardous waste are also not coming under these guidelines, because for that we are having separate authority, right? Hazardous microorganisms, right? Genetically engineered microorganisms, all of these things are not coming under our biomedical waste management guidelines, right? Now let's talk about these symbols, right? These symbols, right? So they are also asking these kind of symptoms. You might have seen them in the radiology also. So biohazard, this is the symbol of biohazard. This is the symbol of radiation hazard, right? Radiation sign, you might have seen this in many places also, right? Basically where the radiation radiation exposure risk is there. This is the sign for cytotoxic, right? Cytotoxicity. So these signs you should know, right? As far as this BMW are concerned, these signs might be asked here and there in your exam. Okay, now coming to the main picture, right? Now coming to the main picture, guys, that is your biomedical waste management guidelines. And we are having the four categories in these biomedical waste management guidelines. One is we are having the yellow category, we are having the red category, we are having the blue category, and we are having the white category, right? The black is for different thing. Black color dustbin, right? Black color bin or black color black category is not coming in the biomedical waste guideline. Okay, we are having only four biomedical waste management bins, right? This is yellow, red, blue and white. Black is for the municipal waste, black is for general waste. For example, you took the wrapper, right? You tear the wrapper of the let's say syringe, that particular wrapper will go into the black category, right? Are you understanding? That is the thing. So guys, let's begin with the yellow category. Let's begin with the yellow category over here. In the yellow category we are talking about what? We are talking about lot of things, right? We are talking about a lot of things in the yellow category. Let's say post-operative body parts, right? Body part, any part of the body, right? It could be the human waste, it could be the animal waste, it could be in the human. For example, what kind of waste we shall talk about? Taking the biopsy, right? And the extra part of the body, right? If you want to discard it, you will be discarding it under the yellow category, right? If there is placenta after the delivery of the baby, okay, in the third stage of the labor, we are actually delivering the placenta. After delivering the placenta, are you giving it to the family members? No, they are not taking the they are not taking the placenta. They are going to taking the baby, right? So placenta you have to dispose of somewhere. You will be disposing of it in yellow bag category, right? Then plaster of Paris you will be disposing of in yellow bag. Pathological waste, any kind of pathological waste will be going in the yellow bag. Cotton waste, cotton soiled with blood, cotton soiled with body secretions, cotton soiled with anything, right? Or in even simple cotton, you are going to dispose it in the yellow category bag, right? Dressing materials again you will be actually disposing it in the, for example, gauze piece are there and other kind of things are there. You will be disposing it in which bag? Yellow colored bag. They might be soaking with the blood, they might be soaked with different kind of body secretion, sputum can be there, saliva can be there, all of these things can be there. Still you are going to dispose of them in the yellow bag category, right? Each and everything is very, very important and worthy for the exam point of view, right? So beddings over here, again, bedding, it can be soiled with blood, it can be soiled with sputum, it can be soiled with any other thing, it can be soiled with urine, it can be soiled with feces, right? All of the beddings and all, they will be actually going in which category? That is the yellow category. Then if you talk about the body fluids, contaminated paper and cloth, again, if it is body fluid secreted, right, then it will be, or is it blood secreted, body fluid or saliva, sputum, okay, all of these things, urine, feces, okay. So these kind of things will be actually disposed of in the yellow color category. Then if you talk about the face mask, right, you are wearing the face mask, doesn't matter is it N95 mask or is it any other mask, it will be going in which category bag? Yellow category bag, okay. So beware that usually we are just removing the mask and we are just throwing it anywhere, but it should not be the case. When you are visiting the hospital, okay, you should not be actually throwing it here and there. Actually these mask also, it should be going in the yellow category bag, okay. Once you will be visiting the hospital, right, then you will be seeing these kind of dustbins. Yellow color dustbin is there is red color dustbin is there, then there is black color dustbin is there, white color dustbin you will not see, and the blue color dustbin you will not see, because that is the cardboard and all of these things. I will come to that, but still you will see them, okay, but not in that particular area. So you will be seeing that. For example, this kind of dustbin you can see over here, over there when you will be visiting hospital, right? So then comes the cytotoxic drug. Cytotoxic drug, I mean the anti-cancer drugs and all. If you want to discard them, you will be discarding them not in the black category. This is not the municipal waste now. This is the biomedical waste. So this waste should be actually going into the yellow color bag. Okay, then expired medication, discarded medication, they should be going in the yellow category over there, right? So very, very important, guys. We are seeing that many things which we are using in the hospital mostly is going into the yellow category, right? Now coming next, microbiology, biotech lab waste, okay, this is also going into the yellow color bag category, right? So mostly if the question will be coming, it will be either asking you about the yellow bag, either asking you about the red bag. Why is it so? Why I am saying? Because usually we are actually confusing between these two things, that what to be put in the yellow, what to be put in the red. Usually blue and white is very, very clear, so there is no confusion in that, right? And the examiner knows that if they will be asking you about the blue and if they will be asking you about the white, right, you will be easily understanding and you will easily answer that question. So they want to have some confusion, right? They want to put some confusion in your mind while while they are designing the questions, right? So that is the basic thing. So yellow and red, however, it is easy only, right? Most of the things are going into the yellow. So now let me come to the red color category. So here you can see in the yellow color category, mask is actually going in that. Band-aid is also because band-aid might be having some blood, right? So it might be going to the yellow color category. Expired medications, cytotoxic drugs might be going into that category, right? Now here you can see some kind of blood stained cotton piece or gauze piece, it will be going into the yellow category, right? Some human body part, it will be going into the yellow category. The placenta might be going into the yellow category, right? So the blood stained mask or something like that, okay, it should be anything which is blood stained, it should be going into the yellow category bag, right? So once we understood, so here you can see that on the yellow color bag, right, what we are having on the yellow color bag, we are seeing this symbol. What symbol it is? This is the biohazard symbol, right? We already talked about that biohazard symbol, cytotoxic symbol, right? We have talked about that. So here you can see this symbol and this represents. So one symbol is this one and one symbol is this one, right? It might be cytotoxic, because cytotoxic drugs are also actually discarded in the yellow color bag category, right? So once we are clear with that, we shall move on, right? This is the yellow color bag and this is the dustbin over there. Okay, right. So once we are clear with the yellow color category, now we shall move on to the red color category. In the red color category, what we are seeing, guys, I shall tell you the mnemonic over here. Very simple, right? Anything which you are seeing made up of plastic, anything which is made up of plastic, anything which is made up of rubber, or anything which is made up of tube, any kind of tubes, right? Usually, commonly, it is actually going in the red color category. Let me just expand this. Let me give you the example over here. For example, you are seeing the syringe. I will just change the color. For example, you are seeing the syringe over here. Syringe without needle. Very important point. Syringe without needle and syringe with needle. Different categories are there, right? For an example, this is syringe without needle. This is syringe without needle, and this is syringe with needle, right? This is syringe without needle and this syringe is with needle. This syringe with needle will go in different category. This syringe without needle is gonna go into the different category. This syringe without needle will be going into the red category. Syringe with needle will be going into the sharp container, that is will be going into the white container. I will come to that, but for now I am talking about the red color category. So what I am saying, guys, be very careful. Syringe without needle, I am saying syringe is made up of what? Plastic. Syringe is made up of plastic. Now one tricky point can be here. Now in this syringe there could be a blood. In this syringe, let's say you took the sample of the patient, there could be a blood. So blood, if you want to discard, you will be discarding the blood into what category? Yellow color category. And then rest of the plastic syringe you are having, then without needle, you will remove the needle, dispose of in the white color category. And rest of the syringe over here, that is made up of plastic, obviously, you will be discarding it in the red color category. Understood? So that should be very carefully understood. Now IV sets, they are made up of what? They are made up of plastic. They will be going to the red color category, right? Then the catheters. Catheters, for example, Foley's catheters, right? So they should be going where? You remove the Foley's catheter from the patient, right? It could be the male or it could be a female catheter. It will be going where? Red color category, because made up of what? Rubber. Made up of what? Rubber. So you are seeing that plastic, rubber and tubes, they are going into the red color category. Again, gloves made up of rubber. It could be the surgical gloves, it could be the nitrile glove, it could be any other glove, it could be the blood stained glove, it could be the sputum stained glove, it could be any other staining over there. Let it be blood stained also. This time it will be going in the red color category. Any kind of glove, either is it non-surgical glove, either it is surgical glove, either it is nitrile glove, any kind of glove will be going. Either it is blood stained, either it is simple one, either it is new one only, right? Surgical glove, you were just tearing the packet and it fall down on the ground, right? Obviously now you will not be using it, right? Surgical glove. So here this glove, where you will be disposing of, right? This is unused kind of glove, still you will dispose of in the red color category, right? So no doubt about that. Euro bag, made up of what? Plastic only, where you will be disposing it in the red color category. Here one point over here which I would like to mention over here, I told you IV set is going in the, because it is made up of plastic, it is going in the red color category. But if they are asking you, let's say if they are asking you BT set, question is blood transfusion set, right? BT set or blood bag, right? Blood bag is made up of plastic but containing the blood in it, right? So if you had you were given the task of blood transfusion, and you transfuse the blood, right, within 3-4 hours of the patient, and then you want to dispose it off. Let's say if you want to dispose of this BT set through which the blood has been transfused, and the blood bag in itself, right, it is the used blood bag. So over here, blood bag and the BT set, two things I am having. It should be going in which bag? Technically you might be thinking that BT set is made up of plastic, because IV set, I told you that it should be going into the red color category. But over here, the main catch point is the BT set, if I'm talking about. So be very careful while answering the question. If they're mentioning about the IV set, then it will be going into the red color category. But if they mentioned about BT set or blood transfusion set, that will be going into the yellow color category. Again, blood bag. Euro bag is made up of plastic. Blood bag is also made up of plastic. Euro bag, I told you, it will be going into the red color category. But if they're mentioning about the blood bag, made up of plastic but containing blood inside it. Now, blood bag is actually going into which color category? Yellow color category. Okay, so be very clear with that. Please remember these two things over here, very commonly tested. Why is it so? Why they are very fond of these blood bag and BT set? Because it seems that it should be actually disposed of in the red color category. Let's say you read these topics 3 months back or 4 months gap, right? And you just remember in the exam that rubber, plastics and tube, they are going into the red color category. So BT set, it is plastic, it should be going in the red color category. So these kind of mistakes might be happening in the exam. So that's why this is one topic which should be actually touched upon before entering the exam also, right? So this is one of the revision point topic, because it's a short question is gonna come from here. So BT set blood bag, guys, at the end of the day, this MCQ should not be done wrong in the exams, because this is the part of the yellow color category. Okay, once you understood that, dialysis kit, right, it will be actually going into the red color category. IV bottle made up of plastic, it will be going into the red color category. We can see the Foley's catheter is going into the red color category. Euro bag is going into the red color category. Any kind of syringe will be going into the red color category. If it is having blood in it, blood you will dispose of in the yellow color category, and the syringe in itself you will dispose of in the red color category. Any kind of glucose bottles, RL saline bottle, RL bottle, or any other bottle, you will be disposing it in the red color category. Rubber gloves, plastic gloves, rubber gloves, basically nitrile gloves, or surgical or non-surgical gloves, any kind of glove, stained or non-stained glove, everything will be going into the red color category. Then you are seeing that IV sets and all, it will be going into the red color category, right? Vacuum they will be going into the red color category, right? Made up of plastic, tube and rubber. All of these things are gonna discarded off in the red color category, except I told you blood bag and BT set. So be very careful with that. Okay, once we are clear with that, now let's come over to the white color category over here. In the white color, this is, you can see, this is not the dustbin kind of thing. This is kind of a plastic set. It could be there, or plastic box could be there. It will be transparent in color. So while going to the hospital, right, you might be seeing this particular plastic kind of set, plastic kind of box, where they have mentioned about that it is a sharp container. They will be mentioning about sharp container with the sticker. So over here we are seeing that the sharps, basically white is for sharp, right? So basically, the blades, for an example, you can see the blades will be going off in that category, right? The needles will be going off. There is a syringe with the needle you will remove and will dispose of where? Will dispose of in the white color, that is a sharp, right? Then any kind of sharp, right, that will be going into the white color category. Basically that is the thing. So here you can see the needles could be there, right? The syringes with the fixed needles, I told you this difference already, right? Syringes with the fixed needle will be going into the fixed needles where you can't remove the needle, right? It will be going into the white color category. But the syringes where the needle can be removed, so you will remove the needle and that will go into the white category. Syringe in itself, that will go into the red category. But syringes with the fixed needle, they will be going into the white color category only, right? Okay, blades, because they are sharp, they will be going into the white color category. Scalpels, because they are sharp, they will be going to white color category, right? Okay. So over here, one more thing, guys. I told you that it is the responsibility of common biomedical waste treatment facility that they will be treating or disposing of in this kind of biomedical waste, right? You are not going to do the pre-treatment, right? Basically, you will be just collecting it in the common area and they will come and they will take care of it. They will take it away, right? But here, if we talk about the white one, right, we need to treat it with the 1% of hypochlorite, right? We need to treat it with the 1% of hypochlorite solution for disinfecting glass and the metal sharps, right? Because I will be telling you further that they have to go for the deep burials, and also I will be talking about that. So for that purpose, they should be treated with the 1% hypochlorite solution for disinfecting the glass and the metal kind of sharps, right? Now let's come over to the last category over here, which is the blue color category, right? Now let's come over to the blue color category. In the blue color category, what we can see over here, the broken ampules. For example, there is a sister, right? There is a nurse. Okay, you told them, for example, give any kind of antiemetic to this patient, right? Or give some kind of antibiotic to this kind of patient, right? Once you will be observing them, so once they are taking this particular antibiotic from this particular vial, they have mixed it with the distilled water and all, right, or the normal saline. So now they will be disposing of this empty vial. This empty vial should go somewhere. According to the BMW guidelines, this vial should be going to the blue category, right? Or there could be ampule. For example, you said that give this patient some antiemetic, right? Give 2 ml of antiemetic, let's say, right? In this case, what you are seeing over here, basically from the ampule they will be taking it. So they have to break the ampule first of all. So this broken ampule will be going somewhere. This broken ampule will be going into the blue color category. Are you understanding what I'm saying? So broken ampule, so glass thing. Here I'm not talking about sharp. This is not needle. This is these are the basically glass ampules or glass vials. So glass things, right? For an example, you can see the glass ampules, broken glass ampules, lab slides. Okay, there could be the vials which are made up of glass. Okay, all these kind of things. So metals will be going over there. For example, nails. What kind of nails I'm talking about? I'm not talking about these nails over here. I'm talking about those nails which you are using as an ortho implant, right? Orthopedician. For example, you are assisting the orthopedician, right? There was a implant removal, right? Well, let's say, and you want to discard this particular implant. Let's say it was a nail, let's say it was a plate, or let's say it was something else, right? If you want to discard of this particular implant, you have to dispose of where? In the blue color category. And blue color category, basically this is the box, right? This could be the cardboard box, or this could be the plastic box having blue color, right? So usually what you might be seeing in the government hospital over there, they are having one box, cardboard box, and they will be having blue color tape on it, right? Blue color tape on it, so that they are representing that it is a blue color cardboard, right? It is a blue category. So please, whatever broken ampule, broken glass, or whatever things are there, according to the BMW guidelines, we have to dispose of or discard glass, broken ampules, broken vials or glass things over there in the blue color category. Okay, so implants and all, okay, seizures, they should be actually disposed of where, discard of where, in the blue color category. I hope you are clear with that. Okay, so once we are clear, okay, so use with, again guys, we need to treat it with the 1% hypochlorite solution for disinfecting glass and the metal sharp. So glass and metal sharp, they should be actually disinfected with the 1% of hypochlorite solution, right? That thing you should keep in mind. Once we have talked about that, right, it's kind of a revision, right? Now you should be answering me now guys very fast that what will be happening. If you talk about the yellow color category, that will be containing what? That might be containing human anatomical waste, animal anatomical waste, I told you, any kind of soiled waste, expired or the discarded medications, cytotoxic medication, they will be going into the yellow color category. Any kind of chemical waste should be going into the yellow color category. Any kind of discarded linen, mattress, soiled with blood, soiled with any body secretion or somewhat, right, they will be going into the yellow color category. Soiled with blood or body fluid or routine mask and gown, okay, these kind of things should be going into the yellow color category, right? So yellow color, which bag? Chlorinated or non-chlorinated bag? It should be the non-chlorinated bag. According to the recent guidelines, they said that there should be the uses of non-chlorinated, and this is the question guys, there should be the uses of non-chlorinated plastic bags. So be very careful with that. Okay, then microbiota, lab kind of waste also, it is, I told you, it is going into the yellow color bag only. Most of the things are going into the yellow color bag. Chemical liquid waste going into the yellow color bag. So over here what we are seeing that if it is micro lab waste or the lab waste, pathological lab waste, for example, so here separate collecting system is there. Here we are talking about the autoclave. How we are treating this? We are actually talking about the autoclave, save plastic bags or containers, right? So we can do the autoclave for that. How you will be doing the treatment? You will not be doing the treatment for the yellow bag, basically yellow and red bag, you are not doing the treatment. Actually common biomedical waste treatment facility will be doing that. What they will be doing to that, they have to actually do either the incineration or the plasma pyrolysis, right? They are actually done at very high level of temperature, right? The temperature is usually, it might be more than 850 degrees Celsius or somewhere between 1100 to 1300 degrees Celsius. It can be that much temperature, right? So we need to make sure that, in the yellow bag, we are actually putting those things which should be supposed to be going there, right? It's not that you are putting the rubber gloves over there. It's not that you are putting the broken ampules over there in the yellow color bag, right? Obviously, you should not do that. So that's why we should know. It's very important. It's the responsibility for us also that we should be knowing the biomedical waste guidelines. So because it is very useful practically also and obviously theoretical as well, right? Okay. Or we might be doing the deep burial. Okay. Now, once we have talked about that, okay, one more thing, discarded medication, they will be actually sent back to the manufacturer or the pharma companies, right? So, I told you that expired medications and the cytotoxic drugs should also be going into the yellow color bag. So they will be going back to the manufacturer or the pharma companies and all, right? And later it can be disposed of by the incineration. Okay. Chemical waste, if you talk about guys, here, after the recovery of the chemical waste, chemical waste shall be treated before mixing with wastewater. So it should be treated basically, chemical waste and all. What kind of chemical waste? Detergent and all of these things, right? It should be treated first. Directly you can't actually send this into the, water treatment facility because a lot of detergent is there, a lot of other, surf and all of these things are there. So you should be pre-treated it. So before the pre-treatment, obviously you will not be doing pre-treatment. The common biomedical waste treatment facility, they will be doing that. So after the pre-treatment, okay, then it should be sent off to the water disposal facilities, right? Then coming to the red color bag category, right? In the red category, I told you that whatever things, tubes, plastics and the rubber, these should be disposed of or discarded of in the red color category. So here we are seeing that contaminated waste or the recyclable waste. So be very careful. Here we are seeing that which kind of bag, I already told you. We are using chlorinated or non-chlorinated bag. We are using the non-chlorinated bag, right? So we are using the non-chlorinated bag over here, right? Okay, so what should be doing with that kind of thing, right? How they will be doing the treatment for this one? Okay, what they will be doing to this particular waste? They will be actually doing autoclaving, or they might do the microwaving, right? Now microwaving is a low temperature system, right? Autoclaving we are doing for 121 degrees Celsius for about 30 minutes, right? So under the 15 lbs pressure. So hydroclaving can be done followed by shredding or mutilation. So autoclaving, microwaving, or you might be doing the hydroclaving for the red color category, right? For the yellow color category, I told you incineration or plasma pyrolysis, right? Okay. Then if you talk about white color category, that was the translucent, right? Okay. And one more thing, what we are seeing, they are having the biohazard symbol on them. They are having the biohazard symbol, all of them are having the biohazard symbol over them, right? So that is also the thing over here. Now, white one is actually containing the waste sharp, right? It can be blade, it can be needle, right? It can be something else, right? It can be the syringes with the needles fixed with them, right? So these kind of things. So it will be having the puncture proof container, leak proof container, tamper proof container, right? So that there is no leaking of that. That's why we are using the plastic container, translucent, transparent plastic containers. So what should we do with them? Okay, I told you that 1% hypochlorite we are doing the pre-treatment for them, but still autoclaving or dry heat sterilization can be done over there, right? After that there could be the shredding or the mutilation. Okay, and they should be actually encapsulated in a metal container, right? And they will be going for the deep burial technique. Okay, so cement, concrete, okay, we'll be using that, but it's not the responsibility of us. They will be CBWTF, right? Common Biomedical Waste Treatment Facility. They will be doing this thing. Blue color category, if you talk about, we were actually disposing the glassware, those broken ampules, broken vials, these kind of things were going into the blue color category, and the metallic body implants, they were going into the blue color category. So over here we are talking about the puncture proof or the leak proof boxes should be there. I told you it can be a plastic color container or which is actually having the blue color on it, or there might be the cardboard boxes which will be having the blue color tape on it, so that it is representing that it is a blue color cardboard or blue color category of the BMW guidelines, right? So container with the blue colored marking over it, the things will be representing the blue color category over there. So we'll be doing the disinfection for these one, okay, by the autoclaving or microwaving or the hydroclaving, just like the red color category which I told you over there, right? So once we are clear with that, now we shall move on to the subcategories of the yellow color category. I told you so many things are actually disposing of in the yellow color category. So there are subcategories of the yellow color category, and the question might come that, for an example, placenta you will be disposing of in which color category? Obviously you will say that it is a yellow color category, but is it yellow A, B, C, D? These kind of options might be coming. So let me talk about them as well. So over here we are seeing that these are the subcategories of the yellow color. So we are seeing that these are the subcategories of the yellow color bag subcategories. Okay, so let's talk about them as well, right? So this topic is very, very important, guys. Just be with me over here. So yellow color bag subcategory, right? Or yellow bin subcategories. So here we are seeing that, here what we are seeing, yellow A, yellow B, yellow C and yellow D. A for anatomical waste. Okay, so we are seeing that anatomical waste, for example, placenta or some body part, human body part, I am saying, that will be going where? In the non-chlorinated yellow bag. So they will be going in the non-chlorinated yellow bag. Obviously, incineration or plasma pyrolysis will be done later on, or deep burial will be done later on. Then there is a human anatomical waste, right? Human anatomical waste, or B for animal anatomical waste. So animal anatomical waste will be going into the, again, yellow category. Soiled waste, that is the yellow C category. Again, it will be going into the non-chlorinated yellow bag. Expired, D for discarded. So D for discarded medications also, they should be going into the yellow color bag. That is yellow D category. Okay, yellow D category, right? Okay. Then I told you yellow D category, expired or the discarded medications, right? Or the cytotoxic drugs, D for drugs, they will be going into the yellow D category. Okay, so yellow A anatomical waste, yellow B human anatomical waste was yellow A, then yellow B is the animal waste, yellow C is the soiled waste, right? And yellow D is the expired drugs or the cytotoxic drugs, right? They will be coming into the D category, yellow D. Yellow E is the chemical waste, right? Yellow E is the chemical waste. They will be again going into the non-chlorinated. Please remember, non-chlorinated plastic bags, right? Again, incineration, plasma pyrolysis we can do over there, right? Or encapsulation. So chemical liquid waste now. F for chemical liquid waste or X-ray liquid waste. Okay, they will be coming into the yellow F category, right? So here separate collection system should be there for this one, for the effluent treatment system, right? Because directly we cannot actually send them in the water facilities, right? So pre-treatment should be there before mixing with the other wastewater, right? So that should be there. Obviously it is not your work, CBWTF will be take care of that. Discarded linen, right? It is yellow G category. Discarded linen, it could be soiled with some kind of body secretions, right? It can be soiled with the blood, contaminated with the blood or body fluids, right? It should be again going into the non-chlorinated yellow bag. I told you that already. And here also we are talking about the incineration or the plasma pyrolysis. Okay, that is the thing. Microbiology waste or the biotech lab waste or the patho lab waste, okay, these all of the waste, okay, they are coming in the yellow H category, and over here we are doing the autoclave for them, right? So pre-treatment should be done over there with the non-chlorinated chemicals, right? And then according to the guidelines you'll be doing the treatment for that, right? Basically incineration and all, right? So this is about the yellow color subcategories, right? Yellow color subcategories. So once we have talked about the yellow color subcategories and all, Okay, let me tell you over here that I hope you're clear till now, right? So basically guys, how many bags we are having? Yellow color bag, red color bag, blue color bag, blue color container you can say, and the white color container. Okay, so we should be very clear that what kind of waste should be going into the what category, right? Once we are clear with that guys, I told you that pre-treatment is generally not needed, but pre-treatment will be needed for what? Pre-treatment, okay, is generally not needed, right? But pre-treatment will be needed for the pre-treatment is needed for yellow F category, G category and H category. Okay, because I told you in the H category there is micro lab waste or biotech lab waste or patho lab waste, okay, these kind of waste. In the G category I told you discarded linens and all of these things, right? They should be pre-treated, right? And yellow F category I told you that there are the chemical liquid waste, right? So they should be pre-treated before actually releasing them into the water waste facilities, right? So that is the thing over here. So this thing we should keep in mind, otherwise other kind of yellow subcategory should not be pre-treated by us, right? Okay, now we have talked about 4 bags, right? Let me tell you that they are having a symbol over them. Over all of them we saw that there was a biohazard symbol, right? Along with the yellow color bag, I told you that biohazard symbol is there, along with that cytotoxic symbol is there, you know. If I talk about, I told you there is a biohazard symbol, this is the biohazard symbol over there, right? And this is the cytotoxic symbol. So 2 symbols are present over there over the yellow bag. If you talk about the red color bag, there will be the biohazard symbol present over it. There will be the biohazard symbol present over it. If you talk about the white color container, okay, there will be the translucent and they will be mentioning about this is the sharp container. They will be actually writing on some paper and they will be sticking on over the this translucent, transparent white color container, okay, or transparent color container. So that will be mentioned over there. In the blue color category, they will be mentioning about with the blue color, they will be representing it, or it will be having the blue colored kind of plastic container, right? So that is very important. Now, if you talk about some more point over here, as far as these BMW guidelines are there, you know, if you talk about the blue color category, right, it should be cardboard or either it could be the plastic blue colored container. Over here, bag, what is the thickness of the bag? So the bag thickness should be more than 0.5 micron. Okay, it should be more than 0.5 micron thick, and I told you, as I told you, that it should be non-chlorinated. It should be non-chlorinated. Okay, now one more thing over here. If you talk about the COVID bags, okay, for the COVID treatment facility, I'm coming to that. So if you talk about the COVID bags, guys, they should be actually double layered. COVID bags, they should be double layered, and over them we should mention, right, or we should be labeling them with COVID waste. Okay, we should be writing that these are the COVID waste, so that everybody knows that this is the COVID waste which is actually transported, right, getting transported, right? Okay, now we are coming to the one more very important topic, that is the COVID waste management guidelines, right? They were actually came into the picture at around 4 September 2020, right? So let me just tell you, let me just introduce you with these guidelines also, right? Once you are clear with the BMW waste management guidelines, right, now it will be easy for you to understand this one, right? So let's talk about the COVID waste management guidelines. Okay, COVID waste management guidelines, okay, 4 September 2020, that was a recent update. So COVID waste management guidelines, let's talk about them. So it is very simple to understand, guys, once we have understood the BMW waste management guidelines. Okay, so if till now you are having any kind of confusion, right, just, you know, pause the video, just go back, revise your notes a bit, right, and then come back over here, right, and you will be understanding everything about it, right? Okay guys, so once again it will be kind of a you know, revision kind of session for you guys. So first one we are having, that is a black color category over here. I will not say it is a category, it is not even the part of the biomedical waste management guideline, but basically, you know, in the black color category, what I'm putting on, I'm putting, you know, all the other kind of waste which we are generating in the household, basically. For example, you know, leftover food, or plastic bottles can be there, cans can be there, you know, simple any kind of you know, plastic can be there, or any other kind of paper can be there, okay, or cardboard can be there. These kind of things you will be actually going you'll be actually disposing of over there. So this is basically the solid waste. I mean to say that these are the solid waste, and solid waste, you know, wrappers and all of these things, they should be going to the black category. Same with the biomedical waste management, which I told you earlier, and this is not even the BMW guideline. Basically, this is the municipal waste. So that's why I didn't mention it over here. So basically, you know, if you're opening the Foley's catheter for inserting the Foley's catheter into the patient, you'll be inserting the Foley's catheter, but you know, packet. Why there is a packet? Because they want to keep it sterile. So where will you put this packet over there? Packet will go into the black color category, right? You want to put on the gloves. Where you will put the packet of the glove? Packet will go into the black color category. Okay, so I hope you understood that point. Now, second point over here, let's talk about the yellow color category. So I'm writing it with the yellow color only. So yellow category, right? In the yellow category, again guys, in the biomedical waste management guidelines also, I told you many of the things are going over there. And here also I'm going to talk about that many things are going over there. For an example, you know, for the health staff, right? If I talk about for the health staff, right? You are a health staff only. Okay, you will also be included in the health staff only. So if you are talking about yourself, right, what you will be doing basically, let's say you are actually working in the COVID ward, right? COVID ward. So what we used to do basically, you know, whatever, you know, once there is a donning and there is a doffing, right? You will be actually, you know, wearing the PPE kit and all, and you will be removing the PPE kit also. So where to dispose of what things, you should be knowing about that. So this is about the COVID waste management guidelines, right? Are you understanding? So basically guys, over here we shall say that, you know, for you guys, if there is a used mask, right, you are doing the doffing over there. If there is a used mask, you will be actually putting it into which category? Yellow color category. There is a head cover, right? Or there could be a cap, or there could be a shoe cover, right? All of these things will be going into the yellow color category, right? Or there could be a disposable gown, right? You might be wearing that particular gown, right? So disposable gown also you will be putting in over that particular category, right? Or there could be, you know, semi-plastic or non-plastic kind of coverall. So semi or non-plastic coverall, right? That also should be actually disposed of in which category? Yellow color category, right? Okay. Now if we talk about the red color category, guys, if we talk about the red color category, let me mention about the red color category also. So red category bag, right? Red category bag. I'm just writing it with the red color, right? In the red color category, okay, again guys, just remember that rule which I told you. Rubber, tubes, plastics, they are going into the red color category, that I told you in the BMW guidelines also. So here also I'm just repeating the same things over here. Okay, nothing new. For an example, you have used the PPE kit, right? So over here, used PPE, I'm saying now, used PPE will be going into the which category? Used PPE. Used PPE will be, you know, personal protective equipment. PPE is personal protective equipment. That was very famous word which was used in the COVID era. So used PPE will be going in this category. Goggles, they are made up of plastic. Obviously, they will for the eyes protection. So they will be going in which category? Same. This will be going into the red color category. Face shield is made up of plastic. They will be going in which category? Red color category, right? That hazmat suit, if they are asking you, then it will be going in which category? It will be going into the red color category. Your gloves, any kind of gloves, I told you already also, right? Nitrile gloves or any other kind of gloves, you know, surgical gloves, non-surgical gloves, stained with blood, do not stained with blood, stained with some body secretions or not stained, right? They will be going to the they will be going to the red color category, right? Now coming to the blue color category. So I'm just writing this thing with the blue color only. So if you are talking about blue color category, I'm talking about the COVID guidelines, right? It will be remaining same. Broken ampules, broken wires, glass kind of things, they will be going in that particular category. So blue color category, if I'm talking about, then you know, the used glasses, ampules, broken ampules, and all of these things, broken ampules, vials, right? The glass materials will be vials, etc. They will be going into the blue color category, right? Now let me come over to the white color category, right? Obviously I don't have the white color, so I'm using the black color over here. So white category, right? So white category, if you talk about, I told you for the sharps, right? For the BMW guidelines. And in the blue color category, I told you for the glasses. So same things, right? Blue and white, it is almost same for the COVID also and for that also, right? It is just change between the yellow and red, some changes. So white category over here, in the white category, we shall talk about the sharp. For example, needles, you are using the needles over there, okay? Or you are using the sharps, right? Over there, right? So these kind of things are actually going into which category? Again, guys, that is the white category. So nothing new about that, okay? So once we have talked about that, one more thing let me mention over here, that you know, there could be the wet waste which are actually coming from the hospital. There could be the solid waste, okay? These bags, if I talk about the COVID bags, okay, they should be double layered, which I told you. And one more thing, that you know, wet waste, or let it be the solid waste, they should be actually tied very securely. They should be tied with the gooseneck, right? So basically I'm saying that, wet or dry, okay, let it be any kind of waste, dry solid waste or the wet waste, okay, these bags actually should be tied securely, should be tied in a gooseneck pattern, right? In a gooseneck pattern, right? Gooseneck pattern means, if this is a bag over here, right, this is a bag over here and this is the last part of the bag, so it should be actually covered in this manner, right? It should be actually one tied over here and once it will be tied over here itself, right? So it is a gooseneck pattern. So in this manner you should be actually tying this bag particularly, okay? So once we are clear with that, in a gooseneck pattern, okay, in a gooseneck pattern, okay, one thing. Now one more thing, it should be sprayed with the sodium hypochlorite solution as well, right? So should be sprayed with the sodium hypochlorite, solution on a daily basis until it will be taken by the some facilities, chloride solution, right? Okay, so that is also very important if you talk about the COVID waste, right? Whereas in the BMW I didn't told you anything like that. Okay guys, one more thing over here, compostable bags and all compostable bags actually they are used for the wet waste, right? Okay, now the point which we need to remember further that the healthcare workers, right, they should be vaccinated. If any kind of healthcare worker which is actually related to the biomedical waste management guidelines, they should be vaccinated with two particular vaccines. One is the hepatitis B vaccine and other one is the tetanus vaccine, right? Because we are working in that particular high risk area. When you will be going to the hospital and you want to join for internship, let's say, or you want to join any kind of government or private hospital, they will be asking for two things. This particular vaccine status, do you have the immunization status for these vaccines for the hepatitis B? If you are unable to show that, then you have to get the vaccine. You have to get the hepatitis B vaccine and then they will be taking you, right? And with that they will be taking the blood test for you. They will be running all the blood tests whether everything is fine in your body and like that, right? Before joining the medical college or before joining the hospital, right? Either it is private, either it is government, things are same, right, for both of them. So over here I am saying that healthcare staff which is related to the BMW, obviously they are related to the BMW, they should be vaccinated with the hepatitis B and the tetanus vaccine, right? So basically I am saying that healthcare workers which are involved, healthcare workers who are actually involved in the BMW guidelines, right? BMW guidelines should be vaccinated with hepatitis B and the tetanus vaccine. Hepatitis B and tetanus vaccine, this is very commonly asked question, okay? So please be careful with that. So hepatitis B and tetanus vaccine, obviously because you are working over there, there might be the chances for the hepatitis B patient prick, right? You might be actually injecting that patient, you might be giving drug to the patient, or you might be taking the sample of the patient, you might be cannulating that patient. During these kind of procedures, right, you might be getting the prick. If unfortunately you'll be getting the prick, right, obviously you need to report it in the disaster management category, right? And you should be getting the treatment for that, prophylaxis, but you should be having the vaccine, right? One more thing guys, the yearly health checkups are also mandatory who are actually involved in the BMW guidelines and all. So yearly health checkups, okay, and yearly health checkups are actually should be there for every individual actually. So yearly health checkup, right, should be there, okay, fine. And over there, according to these BMW rules, according to these BMW guidelines, BMW 2016 guidelines, hospital, they can actually, according to BMW 2016 guidelines actually, right, if this is a hospital, let's say this is a hospital, right, this is a hospital over here, and I told you common biomedical waste treatment facility, right? I told you about common biomedical waste treatment facility, right? They should be coming to the hospital common area, right? Actually they will be producing the BMW waste, right, biomedical waste, and they will be actually keeping it in a common area. They will be keeping it in a common area, right? Now let's say, right, let's assume that this hospital is in a hilly area, right? And the biomedical waste treatment facility is quite far away. So for that purpose, for the daily purpose, it will not be possible that this particular waste will be transported to that particular far place. For example, it is 100 kilometer away, or it is 150 kilometer away, or it is 80-90 kilometer away. So for that purpose, right, according to the government, right, the hospital shall establish an on-site treatment and the disposal facility, right? But in what condition? In only one condition, that if the hospital and the common biomedical waste treatment facility, the distance between these two, if it is more than 75 kilometers, if it is more than 75 kilometers, the distance between these two, if it is more than 75 kilometers away, right? This is the question also. If it is more than 75 kilometers, then this particular hospital can actually make disposal facility, right? Disposal facility, right? Or on-site treatment, right? For the treatment of the biomedical waste over there, right? In their hospital itself, right? So that was about the biomedical waste guidelines, right? Where we have talked about four important dustbins over here, or 4 important bins over here, 4 important categories over here. One was yellow category, one was red category, one was blue category, and other one was the white category, right? So this was about the BMW. Thank you so much for joining this one. I hope you got some value. I will be seeing you in the next one. Thank you.